our new weekly Faith, Hope, and Love streaming series. Whether you're watching us online on Facebook or on YouTube, we're so glad that you're able to be with us this afternoon. And we pray that you and your loved ones are safe and healthy. A big thanks to our two partner organizations, Catholic Medical Mission Board and America Media, for co-sponsoring today's event, Faith on the Front Lines, a Catholic response to the global health crisis. Now, in one of his earliest and most memorable quotes, Pope Francis referred to the church as a field hospital, a source of healing. And today's guests can really speak to the church's dual role of offering compassionate care to both body and soul, and putting that love into action on the front lines. Serving as our moderator today is our good friend and Sheen board member, Father Matt Malone, President and CEO of America Media. But before I turn it over to Father Matt, I want to encourage you to consider making a donation to the Sheen Center and to our two partner organizations today, because if you value this type of programming infused with faith, hope, and love, we can't do that without your help. We are committed to continuing providing that type of programming, but as I said, we need your help. There will be information on the bottom of your screen throughout the conversation to tell you if you'd like to make a donation to us, to Catholic Medical Mission Board, or to America Media. And any gift, no matter how small, makes a big difference and is deeply appreciated. So without further ado, Father Matt, take it away.
Thank you very much, David, and good afternoon, everyone. Welcome to this live stream discussion of the Catholic Church's response to what is happening in the global pandemic. It makes sense to me that CMMB and America Media and the Sheen Center would partner to host this conversation, because this is a crisis that has multiple dimensions. There's the obvious public health crisis, and there is the accompanying economic crisis that we are going through. But each of those crises has physical dimensions, it has psychological dimensions, it has spiritual dimensions. And so it's appropriate that we would call on a diverse range of resources, from the Sheen Center to CMMB to America, in order to have this conversation today. And I'm really delighted to welcome my two interlocutors, Dr. Mary Leahy, who is the CEO of Bond Secours Charity Health System. She has responsibility for setting the system's strategic vision and providing leadership for system-wide operations and performance at 3 acute care hospitals. Bruce Wilkinson is the president of the Catholic Medical Mission Board and CEO, and oversees all of its operations. First of all, welcome to both of you. Thank you very much for being here. Dr. Leahy, why don't we start with you? I wonder if we could just start out by talking about what you're seeing on the ground right now.
So things are doing much better than we were a month ago, or even 2 months ago. We have begun to see a great decline in the number of inpatients that we have that are COVID positive, and also out in the community. We take care of a large number of patients across Rockland and Orange counties, and we are seeing a decline in the number of new patients that are being diagnosed every day. So that's good news. So we're very pleased about that.
Excellent. And Bruce, you, of course, have a great deal of familiarity with what's happening in the international scene. What are you seeing from where you are sitting right now?
Yeah, thanks, Matt, and that's great to be on with you and Mary, and thank you, David. Really what we're seeing is that America actually and many of the Western countries have been the epicenter of this global health pandemic, which is very unusual, right? We usually believe these things happen in other places. So right now, we're seeing a slow growth of this epidemic happening in low resource countries, Africa, Caribbean, and some of the Asian countries. And so what we're really finding is that we're wondering if there is just lack of assessment, right? Testing going on. The caseloads are relatively low, yet we know with the infrastructure and the weakness of that inherent health infrastructure that once the epidemic levels reach any semblance of what we've experienced, we are in globally in for a very, very rough time, and especially the vulnerable populations in those countries.
Mm-hmm. Now, it seems to me that the special dimension of Catholic healthcare is caring for the whole person, right? Body, heart, soul, and so a question that was raised by one of our viewers, we received a few questions ahead of time, involves that idea. How do you care for or be present to one another, to the whole person, as a Catholic healthcare worker, when treatment of this particular disease actually requires isolation? It must compound the challenge tremendously. Is that what you're seeing, Doctor?
Well, that's very true. It really presents a very difficult situation, but we must remember, at the core of Catholic social teaching is the dignity of every human being. And that's what makes Catholic healthcare so relevant in any time. And healthcare workers carry forth this compassion, and they do this healing ministry every single day, regardless of whether there's a pandemic. And as you said, it's not just a physical aspect of healing, but it's also the emotional, the social, and the spiritual support that's provided right at the bedside that's so important to these patients. And as it is more pertinent during this pandemic, patients are very isolated and they're distanced from their friends and their families. It's a very difficult situation for everyone, including the healthcare providers. But what we have to do is focus on what we can do for our patients, because they are so very ill when they show up at the hospital. And I'm sure it's very disorienting for them because there are no familiar faces. So we remember that the frontline workers are the living connection for these patients. And through their pastoral care at the bedside, they're ministering to the needs of the patient through their full presence. They listen, they offer that personal healing touch. And then we've also used technology to connect patients and their loved ones. We use smartphones, we use various apps like the Family First app, and we use video and telecommunications to make sure that the patient doesn't feel isolated. But most importantly, it's really the bedside touch that matters.
And Bruce, how do you respond to that challenge of preserving that holistic approach in a moment when you're trying to respond to and triage an emergency?
Well, it's the bar is set in the Catholic social teaching, and it is, I think, the distinguishing factor of Catholic healthcare that we recognize the dignity of the person. We also have a real sort of a journeying in solidarity with the suffering in the communities. And I think that's where our work really distinguishes itself globally from CMMB's perspective and many other Catholic health facilities, is that we are in a place where if the communities themselves do not feel we are journeying with them, they feel it, they know it. This is a time when culturally they are collective societies. Most of the societies working in Africa, for example, are absolutely together. Families, many members of the family live in small spaces together. They are completely connected throughout the day because their daily routine put them in immediate contact. And to go in with a message that, well, you need to distance, social distancing. You need to perhaps treat the sick in a very different way than you have previously, or to go into a hospital system and start triaging people, women just coming to give birth, from others who may actually be presenting cases of infection. It is a very difficult culturally as well as what I would say socially. And then at the spiritual side, people are coming to Catholic healthcare because they believe there is that added dimension. They know they'd be welcomed. They know that they'd be embraced. How do we embrace these people as they come? So that has been one of our challenges. There's many examples of how you can do that. it really becomes a challenge to rethink how we approach that inclusion, that dignity of the person, and the embrace they receive when they come for care, because it's critical for their healing.
And you're not just triaging patients and cases, you're also having to make really tough choices, I imagine, in terms of allocating limited equipment, limited resources during a crisis like this. How does Catholic ethics or morality or social teaching really help us to make those choices?
Well, we've been very blessed that we didn't have to make those hard decisions. We had enough equipment to be able to provide the care for every patient that came through our doors, but we had to be prepared for that, and that is a very difficult journey. When faced with this, you can't look at any discriminating factors like age or race or economics or disabilities. You really, again, have to look at the integrity of the human being and recognize the autonomy of the patient, and have those discussions with the patient before the situation arises, and certainly take into respect greatly their own objectives and what their wishes are. We also have to follow our moral principles and turn to the ethical and religious directives for guidance, always remembering the dignity of the individual. And these kind of decisions can't be left to one or two people. It needs to be, a small group of an ethics committee that's formed, which I'm sure we all did. And they should have varying backgrounds, both from pastoral care and healthcare, and looking at the fact that there should be consensus amongst that group of people should they have to make that decision. And most importantly, using the discernment process. It's a very powerful tool, and I think that it should be utilized throughout that prayerful decision making.
Mm-hmm. And Bruce, are your folks on the ground facing similarly tough choices and decisions?
They are. Our situation, probably from Dr. Leahy's, varies in the sense that we have very limited resources, and yet the pandemic has not hit the proportions we've seen in the United States, in Europe. So we are still able to care for and cope, but we've had to create a lot of sort of what I call the logistical sort of support, supply chains for the PPE, protective equipment for frontline health workers. As you know, there are very limited number of health workers in many of these countries, and they are so important to the well-being of their countries. Therefore, their protection and their well-being is just critical to these nations' future. So anytime we ever have a health worker put in danger, it is just really, it can be an amazing loss to a community who perhaps is living with only one doctor at a health facility, which is actually often the case. So where we see what we're doing a lot is to provide these folks with the PPE, the actual protective equipment, and also our frontline health workers. These are people, as you're looking at right now on the screen, actually, we're making sure our frontline, these are people who are actually triaging as patients come to the hospital. These are also people who are going out into the community, teaching about hand washing, social distancing. And these are what we call community health workers. They are an invaluable asset to their communities because they live and reside within those communities. And this, I think these photographs right here that you're seeing are taken from Haiti, and this is what the triage looks like. We have to have the embrace when they show up. We have to know, they have to know they're loved, yet we have to treat them medically in a way that is actually safe for all and actually has their well-being at heart. So it is not easy to shift some of our previous practices in these environments into the new context when we already were resource constrained.
And what your responses reveal, of course, is something that we're learning through this crisis, and that is that it doesn't affect all of us equally. Some people, like Mary, your facilities, have had the resources to grapple with this. Others less so. And what I think in the U.S., who don't live on the margins, what we are learning throughout all of this is that this kind of new normal is the normal for many poor and under-resourced communities in this country and throughout the world. And so the reality of life on the margins is coming home, perhaps people like me who don't live there, in a radically different way than it did before. What do you think that experience of a vulnerability might actually teach us from a Catholic perspective, from a social justice perspective, about empathy, about solidarity?
So, when we reflect on the teaching of the U.S. Conference of Catholic Bishops, we know that we must relate to our family around the world. And it doesn't really matter where we are physically, where we live, or what our beliefs are. When our Lord said, love one another, he wasn't talking about the people across the street. He was talking about all of us throughout the world. And we need to act that way. We shouldn't judge. We have to listen and avoid the indifference, I think, is really important. That can occur when suffering doesn't occur on your doorstep. And I think that's perhaps something that has become very real here in the United States, particularly in the New York metropolitan area, that the suffering is now on our doorstep. We're social beings, and we therefore must stand in solidarity and in empathy with the poor and marginalized around the globe. And, we have to work for the common good of every single person. And I think that this experience perhaps will bring further to mind that reality. We're all responsible, as we've been told, for shaping the future of the planet. So we should pray and stand together to reaffirm that for our daily actions.
Bruce, your thoughts?
I have lots of thoughts. I'll be careful here. I spent 30 years living in Africa and with my family. And when we moved back to the States, we to head up CMMB, which was great to experience. We came with a sense that we are vulnerable because we worked right in the middle of an HIV and AIDS pandemic where 23% of the population were infected. And that was a global health pandemic, and it still remains that way in many contexts where people are vulnerable to malaria, they're vulnerable to TB, they're vulnerable to HIV. So I lived in societies that actually had this sense of vulnerability and the sense of how fragile life can be. And then we come back to America where I don't think we actually had that same sort of experience, right? We as Americans felt a bit self-sufficient. We're okay. We're protected. And now this new place of we're all vulnerable. We're in solidarity with people that we never thought we'd be in solidarity with, or we weren't actually forced to think about. And it's not just the global populations. It's here in the U.S. I really think this COVID piece has ripped off a bit of the Band-Aid on the injustices that do exist in the marginalized in our societies. I've seen that and lived that in some of the more difficult contexts in the world, and yet you see the same injustices in our own society. And I think we have a deep introspection right now to look at our own societies and to try to rectify and to bring some justice into the places and have access for all. We actually, CMMB, we have in our vision statement, quality access to healthcare for all, right, irrespective of person, religion, race. So again, I think this really has made us all feel vulnerable, and we're reassessing, all of us, our vulnerability in light of what everyone is living around the world at this current moment.
And that's really interesting question that is prompted in my brain from what you just said, Bruce. Which is what this isn't the first global health crisis that we have lived through. It's not the first health crisis that you all have lived through. We've dealt with the AIDS crisis. We've dealt with the Ebola crisis. What are the similarities and differences in those crises, when you compare them with what we're going through right now?
So I think if you again look at the value of every individual, we're all made in the likeness of God, and illness particularly this illness, doesn't discriminate on who it's going to attack. And I think that is a, that's pause for us to think about for some time. So if the illness doesn't discriminate, why are we discriminating in, making in our healthcare, in providing healthcare to people? So we can't be judgmental. Faith and medicine go hand in hand, as far as I believe. And again, we have to look at the whole person and the healing of the mind, the body, and the spirit. Even with limited resources, the power of that human connection, what we've learned through AIDS and Ebola, is wonderful. That human connection is there. And there's unity in that human spirit at the bedside. We have to remember that we have to be collaborative across national borders in order to be successful. And that is our new normal, that we need to be far better at doing that. And we must be flexible, and I think we have to stay strong in our faith.
And Bruce, you saw both of those crises up close. What do you think are the lessons that could be drawn from them and applied to what we're going through now?
Well, the first lesson is we all need to take a deep breath. Our societies, our human spirits, our God-created beings, we are resilient people. We will come through this. This too will pass. We will be emerging from the other side of this. We will be different. We will see changes. Yet we are amazingly hopeful, and people who have an image of God for hope inside us, and that is what I think carries us in this current crisis. It's interesting. I actually ended up going to Cambridge in my MBA there, and the college I was in was established in 1350. And the reason the college, Trinity Hall College at Cambridge, was established in 1350 was to retrain clergy, because they all died caring for the poor during the Black Plague in Europe. And then, I go into a career where I'm absolutely, exposed to the Ebola, the HIV work. We've seen measles epidemics where there's no vaccination for children, just wipe out, just an inordinate amount of children who should have been protected. So when you get into the societies that are impacted, when you have orphaning rates under HIV/AIDS of 1 in every 5 children in that country are orphaned, and then you think of how do we build a society, a community, when that number of children aren't being cared for properly, not being educated, not being given health care. And yet I looked, 20 years beyond when I was in the midst of the HIV/AIDS crisis in Africa, and I see amazing hope coming out of those same children that were previously we thought were going to either be abandoned or be turning into children that would just create civil unrest and disruption of the society. No, they're actually children who are contributing to those societies in amazing ways. So there's an amazing resilience in us. And I think it's a God-given gift of looking forward and being people who actually seek the best for the future. And my prayer is that we all stay in that place of encouragement and live in that place that we have hope.
That's a wonderful message. And it reminds me of the men and women I know who work here in the healthcare system in New York. I'm based here in New York City, and I have received messages from them over the last several weeks saying, could you ask your brother Jesuits to pray for us, to pray for my colleagues, to pray for our patients, that that we'll have the strength to do what we need to do. Which raises another important question. How do we care for the carers, right? How do we make sure that the people who are there helping are helped themselves to get through this experience? I imagine it's very tough. Mary, what has been your experience?
Well, the pain and suffering that our healthcare workers have seen over these last couple of months is like nothing that they have ever seen before. This is, a magnitude that has never been witnessed before in this area. And they're really heroes. And I would agree with Bruce. the hope that abounds throughout the organization is tremendous. And, you know, the Ministry of Healthcare is filled with personal sacrifice on any given day, let alone during a pandemic. And these people are incredibly resilient. But this virus has been relentless, and the workers are exhausted, both emotionally and physically. And it's a journey of healing that's going to take time and require support. And we have to listen to them, and we need to watch out for each other. You know, we're offering here across the system, we're offering reflective resources with meditation and group or individual therapy. We've been live streaming Mass, which I know for me personally, watching Mass every day from St. Patrick's. I watch the recording every night before I go to bed. That personally has helped me. But we also have frequent rounding of behavioral health individuals, spiritual care workers, and social workers, and also communication. I think that's really very key. We communicate every day with emails to the staff and town halls and electronic billboards throughout the organization, so that people feel connected and that they know that there are services that they can utilize, whether it's through employee assistance or through community resources for mental health. We also, you know, one of my favorite things that we did is we started pop-up markets at each of the hospitals, so that our healthcare workers didn't have to go food shopping or buy the necessities that they needed for their own families. So I think that was one touch that really was important to me. And most importantly, we celebrate the wins. And I think that we do that every day. Every time we discharge a patient, we actually have a full celebration where there's a parade escorting the patient out the front door with music playing, and I think that is an aspect that needs to be recognized, that we have done an incredible job. These healthcare heroes have done an incredible job.
No, amen to that. We have some questions from folks who are watching, and I want to make sure that we are able to get to them. One we can deal with right off the bat, and I want to ask it of you. It's a simple question. I know the answer, but you know, people ask it, and I want to give you a chance to respond to it. You know, as Catholic organizations, is your main focus on serving people of faith who are in need?
We take care of everyone.
We take care of everyone, right?
Everyone, regardless of faith or any other feature about them. Whoever needs help, you know, we're there for them.
Right. And I think that's certainly true of CMMB too, isn't it, Bruce?
That's right. Yeah, absolutely. We work with so many diverse populations around the world. So yes. Yeah.
We do the work because of our faith, not because of the faith of the people we serve, right? Yeah. There's also another question here, which I think might be helpful. Other than through continued prayer, which of course is a really important help, what more can I do as an individual to help end the pandemic?
Bruce, do you want to take that?
Sure. Sure.
I know a great organization that you can help out.
I do. I head that up, and I have some great board members as well. And we, right in the beginning of this pandemic, right in the early weeks of March, we actually put together a $1.9 million sort of emergency appeal for responding to what we believe the communities in many of the low resource countries are going to experience with this virus. So we're right in this place of protection and really trying to make sure that the health workers are protected. Number two, we're really trying to make sure the prevention messaging gets out, that our community health workers are in the communities, working with the communities, letting them know social distancing is important, that anybody has certain symptoms needs to be treated in certain ways. So all that we're doing is actually generated by the great resources that CMMB constituents are making available to us. I think we're at $700,000 of our 1.9 million fundraising goal, and that is to actually cover 5 countries, multiple health systems, probably around 1,500 community health workers, and on a numerous amount of clinical health workers as well. So we're basically buying the protective equipment. We're basically purchasing all kinds of hygienic. We're providing clean water. We're drilling new wells so people can wash their hands. We're setting up triage systems where the communities actually know how to actually assess and to guide people who may be symptomatic. And we're also part of a surveillance system that actually helps the health authorities in those countries to monitor what's going on, and there can be adequate response. So yes, we're an organization based on donations, and we've been around for 110 years doing global work, and we're right in the middle of this. In fact, I tell my staff, there's no better place to be than at a mission that is driven by healthcare, the global mission at CMMB, because we are making a difference. We'll continue to make a difference in the lives of so many of the vulnerable people around the world.
I was just saying to my staff earlier today, we're in, of course, very different work as journalists reporting on these things and commenting on them. But I say, it's actually a gift to, in a crisis like this, to be able to do something, to know what you have to do, and that thing is actually, your job, whether you're a journalist or a physician, healthcare provider, or leading an NGO, that there's a certain, that in itself is a gift. It helps, I think, with that that sense of helplessness, which we all feel on some level. And so one question that I wanted to make sure that I asked both of you is there something that you could share with us about how this experience has affected you in some way, either a grace or an insight, or caused you to think about something in a new way over the last several weeks?
For me, I think the word community has taken on new meaning. We always talk about being in community, but the outpouring of love and support from members of the Rockland and Orange County community has been tremendous and has been very touching for me. And also resilience. I think looking at our healthcare workers and seeing just what an incredibly wonderful job, it does inspire me. And I am very grateful for all of that. It has given me much to reflect upon during these months.
Bruce, how about you?
Yeah, our staff has been amazing. We've pivoted to this new way of working, right? We're all working remotely except for our frontline health workers. And it's just been amazing that our staff have shown this grace, resilience, flexibility, and continuing on mission, right? They're focused on mission. And the other is our country directors in these countries. They're all nationals: South Sudanese woman, Kenyan, Peruvian, Haitian, Zambian. The leadership that we have and the inspiration they are to their national context and to the communities we serve has just they have risen above every expectation I could have had, and I'm so proud of them.
Well, Bruce Wilkinson and Mary Leahy, thank you so much for joining this conversation. And my thanks to all of you at home who have been watching and learning along with me about what is happening on the front lines of this crisis. I think I would be remiss as a priest if I didn't say our first duty is to pray for our healthcare workers, to all those who are coming to the aid of others, for those who are suffering, for their healing, for their consolation, and also in gratitude for the helpers who are making a difference. So my thanks to all of you for watching, and be assured of my prayers for you and your families in the days and months ahead. And now I'm going to turn it back to David from the Sheen Center.
Thank you, Father Malone. And I'll just take up with that same thought about gratitude. Thanks to Father Malone, thanks to Dr. Leahy and Bruce Wilkinson, and thanks to you. Again, we can't do it without you. Bruce was talking about how we're really all serving the same mission. We just do it in our own way. So I encourage you. I encourage you to support CMMB. I encourage you to support American media. Of course, I encourage you to support the Sheen Center, because with your help, we can continue to live in that space that Bruce was talking about, that space where we have hope, as the tag of American media says, because hope is a breaking news. And we want to continue bringing that hopeful news to you. So again, thank you. We invite you to join us next week for our next Wednesday streaming event, which we will be announcing later in the week. Until then, we keep you all in our thoughts and our prayers. Stay safe and be well. God bless and have a great day.